Hello, welcome to Acharya Nidana Academy. In this particular video, we are going to discuss the concept of Pariksha. So, what do you mean by Pariksha? It is, in literally terms, it is considered to be the method of examination or the method of assessment. But it is being mentioned in Ayurveda classics regarding the Pariksha. That is the Pramanaihi Arthavadharanam Pariksha. It's a description told by Vatsayana. Pramanaihi Artha Avadharanam Pariksha. So, Pramana means it is the documents, which may be either in the form of the spoken word, or either form of the written word, or either in the form of some kind of the inferences, or some kind of the, what do you say, that the strategic thinking as a logical thinking. So like that. So that is what we can say. That is the pramana. Artha means the exact meaning. Avadharanam, that means receiving or perceiving the exact meaning by the different reliable documents. That is being termed as pariksha. Chakrapani Datta says, Parikshante Vyavasthapyante Vastu Swarupam Anaya iti Pariksha. Parikshante Vyavasthapyante Vastu Swarupam. So that means exact nature of the whatever you are going to do, the examination. So here in this particular context, exact nature of the human being. So which will be done by doing the various kinds of the, what do you say, that the that is what we can say, the reliable different documents or some kind of the physical maneuvers. What we can say, that is about pariksha. Chakrapani says, Parikshakarano hi kushala bhavanti. When a person is skilled in different types of the analysis, or who is well versed in these kinds of the different analytical processes or the mechanisms, they will be successful. Kushala bhavanti, or skilled or successful. So further it is being mentioned in Charaka Samhita, Vidya Vitarko Vijnanam, Smritihi Tatparata Kriya, Yasyeti Shadgunastasya na sadhyamati vartate. So that means Vidya, that means accurate knowledge. So textual knowledge. So in the textbooks of Ayurveda, such as Ashtanga Hridaya or Charaka Samhita or Sushruta Samhita, you have to know what are the exact references and what is being mentioned in the commentary. Those aspects that has to be learned with deep understanding. So that is what we can say, the Vidya. Vitarko. So that means the exact logical reasoning. How you are going to say the person is suffering from Vata dominant disease? What is the, how you are going to say the person is suffering with the dominant disease? What are the mechanisms that is happening in case of the Kapha dominant clinical condition? And how you are going to decide whether the Shodhana or Panchakarma is necessary, or simple medications are necessary, or no treatment is necessary, or simply alteration in the diet and regimen can be helpful in the improvement in the situation. So all these would, we can say, the vitarka. Vijnanam. So that means a skilled knowledge. How to interact with the patient. How to do the examination of the patient. How to select the medicine of the in case of the person suffering from the disease conditions. And how you are going to say the person is having amasha affliction. How you are going to say the person is having a pakwasha affliction. We are going to say pranava srotas is being affected. What is the nature of the ama present in the body? Whether is it present in the Mahasrotas, or there is it present in the Dhatwagni level, or there is it present in the Bhutagni level? And how we are going to say the do's and don'ts, the things which has to be avoided, or the things which has to be continued, those aspects, Vijnanam, Smritihi, in the sense, so by looking into the experiences, previous experiences, so the person is able to do Tatparata, in the sense he will be doing that uh, treatment, or he will be doing the different examination methods, so that he will be in a better position to pinpoint the clinical diagnosis, Kriya. So that means the appropriate line of treatment. If a person is able to do the all these, then the what we can say, the Parikshakarinu Kushala Bhavanti. So this can be achieved. As far as utility of Pariksha is concerned, आतुरस्तु खलु कार्यदेशः तस्य परीक्षा आयुषः प्रमाणज्ञानहेतोः वा स्यात् बलदोषप्रमाणज्ञानहेतोर्वा स्यात् आतुरः तु खलु कार्यदेशः तस्य परीक्षा आयुषः प्रमाणज्ञानहेतोः वा स्यात् बलदोषप्रमाणज्ञानहेतोः वा. So that means the utility of pariksha is of three folds. Atura balapramana. In the sense, what is the degree of the physical strength of the patient? Whether he can able to do his routine activities, or whether the person is unable to do his routine activities. Even sleep is difficult, or whether the person is the walking is difficult. So that means that is indicative of Atura Bala Pramana is little bit abara. Atura Dosha Pramana, in the sense, the degree of dosha vitiation. If the person is having the exposure of, what do you say, that the Ruksha Bhojana for 3 days, in another instance, the person is having the Ruksha Bhojana for 15 days. In these two occasions, the person who is having the exposure of Ruksha Bhojana for 3 days, he will be having the milder vitiation of Vata dosha. But who is having the Ruksha Bhojana for 15 days, he will be having the more severe form of Vata dosha vitiation when compared to the first example. So like that, Atura dosha pramana can be analyzed. Atura ayu pramana, that means the lifespan of the individual can be attained or can be known by pariksha. That means if the person is having the, what do you say, that the Shava Varana, that is considered to be Vikrita Varana. What we can say, the cyanosis as such. When you are going to observe cyanosis in the lips, tongue, etc., it is indicative of central cyanosis. So that means he is suffering from major cardiac or respiratory disease. Or when you are thinking about the dark yellowish discoloration of the sclera, tongue, skin associated with itching, etc., that is indicative of the severe form of, what do you say, that the hepatobiliary dysfunction. So like that, so Atur Ayu Pramana, so the lifespan of an individual can be predicted. So when you think about the regarding the other examples, as far as the Pariksha is concerned, Ayurveda says Aptopadesha, Pratyaksha, Anumana, and Yukti. These are the what do you say, that the examples for Pariksha. When you say regarding interacting with the patient, if the person says, I'm having headache, I'm having abdominal pain, this indicates the vitiation of Vata dosha. Sushruta says, Vata drite nasti ruja. So that means when you are going to see the ruja or discomfort or pain, that indicates the invariable presence of Vata dosha vitiation there. Presence of raga or redness, that indicates the vitiation of pitta dosha in the body, where the redness is being observed. So that means pittasya daharagoshma pakitaha raga. It is considered to be pitta dosha vitiation. We can able to predict presence of swelling, that is shotha, that indicates kapha dosha vitiation. So this is what we can say the aptopadesha. As per the textual descriptions, we can able to predict the what do you say that the vitiation of the dosha or the vyadhi vinishya can be done. The presence of antrakujana, so that means gurgling sound in the abdomen. So it is the one of the pratyakshataha pariksha. So that means you are going to use your ears, or the clinician is going to use his ears to check the antrakujana or gurgling sound in the abdomen. This is indicative of either apanavata prakopa, that means viloma pravritti or reverse movement of the apanavata, which in turn results in the reverse movement of the samanavata. Thereby, the person will be having the Agnimandya or Avipaka. In this way, presence of Antrakujana will be helpful in determining the or the diagnosing the disease as such. Absence of Udgara Shuddhi, that means the absence of pure belching, or Utsaha, or the absence of enthusiasm, or absence of Lakuta or lightness of the body, that indicates derangement of Agni. So the dysfunctioning of the Agni that is being mentioned in Madhava Nidana, that is Udgara Siddhiritsaho Vegotsargo Yathochitaha Laghutakshit Pipasacha Jirnaharasya Lakshanam. Udgara Shuddhi, that means if the person is having the belching which is not having any specific taste, that is why if the person takes sweet substances, the sweet taste is not going to be present during the belching, that is Udgara Shuddhi. Utsaha, the presence of enthusiasm. Vegotsargo, that means the proper evacuation of the bowel as well as the urine. Laghutakshit Pipasacha, lightness of the body, and proper appearance of hunger and thirst. This indicates the proper functioning of Agni. In case of the absence of these, we can able to say dysfunctioning of the Agni can be predicted. This is with the help of Anumana Pramana. Presence of gait, similar to vulture. What we can say the Gridhra. The diagnosis of Gridhrasi is being made. Whereas the presence of Bhekavarna in the sense the color of the frog, which is of considered to be rainy season, which is again Upamana, which is indicative of the diagnosis of Kamala or the hepatobiliary dysfunctions. We can be predicted. Presence of color, skin, which is having the color similar to Ketaki Dhuli. So that means the yellowish white discoloration. Then we are going to make the diagnosis of Pandu. So like that, the Pariksha, that is Aptopadesha, Pratyaksha, Anumana and Upamana will be helpful in the diagnosis of the diseases. And why? So this kind of the Pariksha is knowledge is essential. It is being mentioned. Parikshayastu khalu prayojanam pratipatti jnanam प्रतिपत्तिर्नामयो विकारो यथा प्रतिपत्तव्यः तस्य तथानुष्ठानज्ञानम्. If you split this, परीक्षायाः tu खलु प्रयोजनं प्रतिपत्तिज्ञानम्. प्रतिपत्तिः नाम यो विकारो यथा प्रतिपत्तव्यः तस्य तथा अनुष्ठानज्ञानम्. So that means प्रतिपत्तव्य इति अनुष्ठानेन योजयितव्यः. Let us say with the example. Person is suffering from bloating sensation of the abdomen from the past 2 days. He has changed his place. That means he was on a tour, and because of the irregular bowel habits, because of the change in the place, he actually suppressed the urge of defecation. This in turn results in the Apanavata Prakopa. So that means there will be hardness of the food, the stools take place because of the absorption of the water from the rectum, which in turn results in the reverse movement of Apanavata. So in that, if the particular pathogenesis continues, that may be responsible for the abnormal functioning of Samanavata. In that particular line of treatment has to be done, that is Anulomana. So that means proper Vata Anulomana has to be done. So that is Vata Prakopa Chikitsa has to be performed. So in that way, Pratipattirnama yo vikaro Pratipattavyah tasya tathanushtana jnanam. So identify what particular dosha is being vitiated and identifying the appropriate line of treatment in that particular situation. Suppose if the person is suffering from the dryness of the skin, so in that particular situation, you have to apply the oil to the skin also. So like that, what kind of the treatment has to be followed, that can be identified by appropriate pariksha. As far as types of pariksha is concerned, Ayurveda says two types of pariksha: Roga Pariksha and Rogi Pariksha. Roga Pariksha refers to the examination of the disease as such, whereas Rogi Pariksha refers to the examination of a patient. So, regarding the Roga Pariksha, what actually Roga Pariksha refers to? Ashtanga Hridaya says, Rogam Nidana Pragrupa Lakshanopashayaptibhi. These are considered to be Roga Pariksha. It is also being termed as Panchalakshana Nidana, or it is also being termed as Nidana Panchaka. So that means you need to know about the Nidana. What are the different causative factors for the disease manifestation? Purva Rupa. What are the prodromal symptoms of the disease? Rupa. What are the clinical features or signs and symptoms or lakshana of the disease process? Upashaya and Anupashaya. What are the aggravating or the what do you say that the improving or worsening situations? So which will be helpful in improving and or worsening of the disease process in the patient. And Samprapti, what are the actual pathogenic processes? So these are what we can say. These are what we say that the Roga Pariksha. When you think about Nidana, what kind of the Nidana is a person is suffering from? Whether is it Sannikrishta Nidana, so which is usually considered to be Vatadi Doshaha. That means Vata, Pitta or Kapha, which are present inside the patient, or Dushya, that is Rasa, Rakta, Mamsa, Meda, Asti, Majja and Shukra, and Mutra Purusha Sweda. They are considered to be Sannikrishta Nidana. Viprakrishta as such, they are considered to be the whatever these Bahya Nidanas are being mentioned. For example, Vyayama, Dapatarpanat, Prapatanat, etc. etc. They are the Viprakrishta Nidana. Whereas the Vyabhichari Hetu, they are weak causes which are unable to produce the disease manifestations. Whereas Pradhanika Hetu, which are very strong manifestations, very strong causes for the disease manifestation. So you have to analyze these. Asatmendriyartha Sanyoga Pradnyaparadha and Parinama. You have to analyze the Nidana in terms of Asatmendriyartha Sanyoga Pradnyaparadha and Parinama. Dosha Hetu, Vyadhi Hetu and Ubhaya Hetu. You think about it, whether it is responsible for the with dosha vitiation, or is it responsible for the manifestation of the disease, or whether it is responsible for the both vitiation of the dosha as well as manifestation of the disease has to be analyzed. Utpadaka hetu and Vyanjaka hetu, whether it is actually the initiating factor or triggering factor has to be analyzed. Bahya and Abhyantara hetu, whether it is considered to be Bahya or Abhyantara, it has to be analyzed. In terms of the Abhyantara hetu, you need to know about whether the dosha is present in the Vriddha stage or Kshina stage, or whether the dosha is present in the Shakha or Marmasti Sandhi or Koshta has to be analyzed, or whether the dosha is present in the Chaya, Prakopa stage, or whether the dosha is present in the Chaya, Prakopa, Prasara, or sthana samshaya, vyakta or bheda stage, or whether the dosha are present in the prakrita or vikrita stage, or whether the dosha are present in the sama or nirama stage, all these are coming under the heading of analysis of Nidana. When you think about Purva Rupa, so that is Samanya and Vishesha Purva Rupa has to be checked. In case of Samanya Purva Rupa, the dosha vitiation is little bit difficult to analyze or very difficult to analyze. Whereas in case of Vishesha Purva Rupa, we can able to analyze the dosha may be responsible for the disease manifestation can be predicted. Further, it is being mentioned Sharirika, Manasika or Sharira Manasa Purva Rupa. In the sense, Asya Vairasya, that is the taste imperception, and Alasya, laziness, and Gatra Gaurav, heaviness of the body parts, they are considered to be Sharirika Purva Rupa. Manasika Purva Rupa, when you think about it, Aratihi, that is restlessness. He is not in a position to sit properly in a one particular place. Hitopadesheshu Akshantihi, in the sense, if you give any kind of the well wishes, the person is getting irritated very easily. These are considered to be Manasika Purva Rupa. When you think about Sharira Manasa Purva Rupa, in the sense, person who is having the inclination towards, what do you say, that the Katurasa or Amla Rasa or Labana Rasa, that is Amla Patu Shane, Amla Rasa, Patu, Labana Rasa, Ushana, Katurasa, inclination. It is indicative of Sharira Manasa Purva Rupa. Or otherwise, Sadhu Bhakteshu Dveshaha. In a sense, if the person is having aversion towards the sweet substances, these are considered to be Sharira Manasa Purva Rupa. This has to be analyzed. Rupa, that is what we can say, the clinical features. So this can be analyzed by knowing about the Pratyatma Lakshana. The Pratyatma Lakshana can be analyzed by several parameters. For example, most severe symptom, in the sense, most the troubling symptom or most persistent symptom, nearly 10 different lakshanas are there. Among that, one lakshana may be persistent for most of the occasions. Then chronic symptom, which is present for longer time duration. Widespread symptom. When you think about the human body, symptom may be persisting for wider, widespread, that is the wider part of the body, most parts of the body, or symptom of clinical importance. For example, Gudena Atidrava Mala Pravrittihi, the movement of the liquid stools in excess through the anus, that is considered to be diagnostic feature of Atisara. So, like that, Rupa will be helpful in making the clinical diagnosis. Upashaya and Anupashaya. What kind of the Aushadha is responsible for the improvement in the symptom? Suppose the application of Snigdha or the oil or Taila to the knee joint, if it improves the situation, then we are going to say the person is having a pure Vata dosha vitiation. And Ahara, if the person is suffering from Kapha dominant disease, so that is giving the substances which are devoid of the snigdhata or unctuousness, or which is devoid of taila, then this may improve the situation. Vihara, that is, if the person is suffering from kapha dominant disease, then ideally walking a little bit may improve the situation. Or taking the hot water may improve the situation, depending upon the area of the disease, depending upon the what do you say, that the nature of the disease as such. When you think about samprapti, regarding the which particular type of the guna is going to get increased, whether it's ruksha guna is increased, or lagu guna is increased, or ruksha lagu guna is increased, or ruksha lagu or khara guna is increased, or ruksha lagu or khara or chala guna is going to get increased. That means which can be analyzed by the help of vikalpa samprapti. As far as looking into the clinical symptoms, so there may be a possibility of two dosha vitiation, or there may be a possibility of three dosha vitiation. You have to identify which is considered to be the prime dosha involved in the disease manifestation. That has to be analyzed by the help of pradhanya samprapti. When you think about bala samprapti, whether the roga bala is more or rogi bala is more, that means if the person is able to do his routine activities, then in that particular situation, rogi bala is more. Whereas if the person is not in a position to do his routine activities, even this may disturb the sleep of the individual. This may indicate that the person is suffering from severe form of the disease. That means roga bala is more in that particular situation. Whereas kala samprapti, when you think about it, if the symptoms are more at midnight, this may indicate pitta dominant disease. Or if the person is suffering from the clinical symptoms are more at around 6 a.m. in the morning, this may indicate kapha dosha dominance. So like that, when you think about vidhi samprapti, so that means this may again helpful in making the further subdivision as far as treatment protocol is concerned. So that means let us give you an example. So regarding the Saumya Jwara and Agneya Jwara, so that means Saumya Jwara indicates the person may be suffering from, what do you say that, either Vata dominant disease or Kapha dominant disease. So that means you have to give the line of treatment for either Vata or Kapha. Whereas Agneya Jwara indicates the Pitta dominance. So here you have to give the specific line of treatment for Pitta dosha vitiation. So like that, Vidhi Samprapti is helpful in actually deciding the nature of treatment to be adopted in the individual. So this is how we can able to understand Roga Pariksha. When you think about Rogi Pariksha, textbook says two types of the Pariksha, Pratyaksha and Anumana. Pratyaksha in the sense the direct observation, maybe through his eyes, or maybe through his ears, or maybe through his smell, or maybe through his touch, but tongue is usually not being used. Even in Ayurveda fundamentals, it is being mentioned that it has to be analyzed only by Anumana Pramana. Whereas Anumana, in the sense, you have to infer by looking into the different parameters. For example, Agnim Jarana Shaktya Pariksheta. In the sense, Agni has to be analyzed by the nature of digestive power. Balam Vyayama Shaktya, the bala of the person, can be analyzed by the nature of or the degree of performing the exercises, etc. Three types of the pariksha are being mentioned: Pratyaksha, Anumana, and Aptopadesha. So here, Aptopadesha, it is being mentioned that either it may be the textual descriptions, that is Charaka Samhita, Sushruta Samhita, or Ashtanga Hridaya, or any of these Ayurveda textbooks. Or otherwise, it is also being mentioned the person who is considered to be a teacher. In Ayurveda, in Ayurveda, what we can say, the teachers who are giving the knowledge of Ayurveda fundamentals to the students, or otherwise, when you are going to the bedside or the hospital, patients are the, what do you say that Aptopadesha. They are going to give you the right information so that you can make the diagnosis later. Four types of the pariksha: Pratyaksha, Anumana, Aptopadesha, and Yukti. Yukti in the sense you can able to make his past, present, and future. Let us say, for example, if the person is suffering from ascites, you are going to predict what might be there. That means if he is having the alcoholism, we are going to predict he is having the chronic or alcoholic cirrhosis as such. So that means his past can be identified. His future, that means there may be a possibility of esophageal varices. That means there may be possibility of hematemesis, which is considered to be due to esophageal varices. There may be a possibility of rectal bleeding. which is considered to be, both are considered to be due to the portal hypertension. That is, we are going to predict the future. So that means just by looking into the present ascites, we can able to predict his past, alcoholic liver disease. We're going to predict the future. That means hematemesis or hematochezia. That is bleeding through the either vomiting or through the fecal matter. That is what we can see, the yukti. 6 types of the pariksha: prashna pariksha and panchendriya pariksha. Prashna pariksha, that is interrogation with the patient regarding the nature of the dosha vitiated, regarding the nature of dusha vitiated, regarding the nature of srotas vitiated, etc., can be predicted by prashna. Panchendriya pariksha, that means that is the sparshanendriya pariksha, chakshurendriya pariksha, grhanendriya pariksha, etc., are categorized under shadvida pariksha. Ashtasthana pariksha, nadi pariksha, the doing the nadi assessment. Mutra, that is the assessment of the urine. Mala, assessment of the fecal matter. Jihva, the assessment of the tongue. That is whether it is vata dominant or pitta dominant or kapha dominant nature is going to get observed while in the tongue can be analyzed. Shabda, that means the nature of the production of sound, whether it is considered to be vata or pitta or kapha, can be analyzed. Sparsha, looking into the sparshana of the patient, whether it is vata or pitta or kapha vitiation is being present or not, can be analyzed. Drik, that is related to the netra, whether it is vata dominant netra or pitta dominant, kapha dominant netra, can be analyzed. Akriti, physique of the individual, whether it is vata dominant, vata akriti or pitta akriti or kapha akriti, can be analyzed. Think about the 10 types of the pariksha or dashavida pariksha. It is mentioned that prakrititah pariksha, vikrititah pariksha, saratah pariksha, sammahananatah pariksha, pramanatah pariksha, सात्म्यतः परीक्षा, सत्वतः परीक्षा, आहार शक्तितः परीक्षा, व्यायाम शक्तितः परीक्षा, वयतः परीक्षा. So this is actually helpful in predicting the prognosis of the disease assay. It is specifically not having the diagnostic value, but Dashavida Athira Pariksha is considered to be helpful in predicting the prognostic value. Further, 12 types of the pariksha are being mentioned. That is dosha, bheshaja, desha, kala, bala, sharira, sara, ahara, satnya, sattva, prakriti, and vayas. These are the Dvadashavidha Pariksha are being mentioned. But when you think about the Rogi Pariksha, it is being mentioned only up to the Dvividha Pariksha till Dashavidha Athara Pariksha are usually being practiced as far as Roga Nidana is concerned. As far as physical examination is concerned, which is being practiced nowadays, they are of two categories: general examination and systemic examination. General examination is the type of examination where you are going to do before going to do the specific systemic examination. When the person comes to you in the OPD of in your hospital or in your private clinic, at that particular time period, so you can able to identify the different features. For example, the nature of the gait. If the person is an antalgic gait, that means he is having the pain on the one particular part of the limb where he is giving less stress. So that means the diagnosis of sciatica can be made. If the person is having circumduction gait, diagnosis of pakshagata or cerebrovascular accident can be made. And if the person is having the effortful breathing, that means he is suffering from either cardiac or respiratory disease, can be able to predict it. Or if you are seeing the yellowish discoloration in the face or the sclera, we are going to say the person may be suffering from hepatobiliary dysfunction. So like that, by looking into the patient, whenever he is approaching you at that particular period itself, you can able to make the diagnosis with the help of general examination. Then comes the systemic examination, which is very, very essential before going to make the diagnosis as such. When you think about respiratory system, when you think about cardiovascular system, and when you think about digestive system per abdominal examination, four methods of the systemic examination are being adopted. Inspection, that means seeing the patient, or palpation, touching the patient, or percussion by making the using the two hands, doing the percussion and auscultation, in the sense using the stethoscope, examining the sounds of the chest and abdomen. That is, in case of sounds, that is breath sounds and heart sounds, whereas in case of the abdomen, it is peristaltic sounds. So these are the methods of systemic examination in terms of respiratory system, cardiovascular, and per abdominal examination. As far as musculoskeletal examination is concerned, inspection, palpation, and range of movement assessment has to be done. Whereas in case of the skin, inspection and palpation has to be done to know about the primary and secondary lesions. When you think about central nervous system examination, we have to do the either higher mental function, then speech, then cranial nerve examination, then motor system examination, then sensory system examination. These are the methods of the physical examination as far as the central nervous system is concerned. So these are the things that has to be done while doing the what do you say that pariksha as such. So the take home messages from today's discussion are Pramanair Arthavadharanam Pariksha. So that means Pariksha is the one which will be done to know exact status of the patient's health or ill health by doing that is by looking into the reliable documents, or by looking into the or by performing certain skillful activities. As far as utility of Pariksha is concerned, it is being mentioned that 3. Ayushaha Pramana. So that means that is nature about the lifespan of an individual. Atura Bala Pramana, that is the strength of the patient as such, and Atura Dosha Pramana. So that is the degree of dosha vitiation in the patient. That is threefold are the utility of the Pariksha as such. Whereas Pariksha is of two categories. Roga Pariksha, that is considered to be Nidana Panchaka or Panchalakshana, Nidana, Purva Rupa, Upashaya, and Samprapti. Whereas Rogi Pariksha, that is examination of the patient, they are of two types, Pratyaksha and Anumana. 3 types, Pratyaksha, Anumana, and Aptopadesha. 4 types, Pratyaksha, Anumana, Aptopadesha, and Yukti. 6 types, Prashna Pariksha and Panchendriya Pariksha. 8 types, Nadi, Mutra, Mala, Jekwa, Shabda, Sparsha, Drik, and Akriti. 10 types, Prakriti, Vikriti, Sara, Samhanana, Pramana, Satmya, Sattva, Ahara Shakti, Vyayama Shakti, and Vaya. So, dear ANA members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what would you like to hear in the coming days? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to the maximum number of 2 Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Thank you.